I don't think it's any surprise to any of you that we've got a major problem with healthcare in the United States. When I first went to medical school, I was wondering, just as a freshman, why aren't we studying the healthy? Why aren't we helping individuals achieve their optimal health? And what I learned in medical school was incredibly important. It was how to take care of those who were suffering, who were ill. And at the same time, since I was on the pursuit of health, I started studying the medicine of other cultures and saw that they, as opposed to us, were almost completely focused on health and wellness. So I am very proud to be chair of the Integrative Health Policy Consortium, where that's our mission. Whoops. Our vision is to envision a world where there are no barriers to health, none. No barriers in regard to access, no barriers in regard to the environment. When we talk about the environment, we're not talking about the obvious things we first think about, which are environmental toxins and pollutants. We're also talking about pollutants in terms of relationships, pollutants in terms of the hectic lives that we lead and the effects it has on our immune system and our health. Ecological human pollutants as well. And socioeconomic. We have a group that's part of IHPC that's called I Am For Us, Integrative Medicine for the Underserved. Integrative healthcare, integrative health has been developed over a half a century, believe it or not. We finally matured to the place where we have evidence, we have an argument, and we are slowly turning the health system around toward wellness and well-being. So those basically is our mission. Our vision. Our mission is to eliminate barriers to health, and that has to do with that prevents people from receiving the services they need or choosing the type of provider they want to promote to maintain health. And this is where I was speaking about I Am For Us, which is one of, I'm sure, other organizations that are focused on the fact that due to the fact that I had mentioned access, and there is relatively poor access to disciplines that are very effective and safe, we now have to have third-party coverage. We're doing plenty of work with, and you'll hear from people in the DoD and VA about what we're hoping to accomplish within those systems, and it's not going to be, hopefully in the future, only a rich person's ability to receive health and wellness services. Our philosophy is that we believe in an integrative healthcare system, an interdisciplinary team, an MD working with an acupuncturist, a massage therapist, a Reiki therapist. When I was at GW doing my residency, we didn't talk about it, but we snuck a Reiki therapist into the cardiac care unit and intensive care unit because we saw the results, but culturally, we did not want to speak about that at that time. It's time to break all barriers to health. Holism and pluralism. We're talking about the body, the emotions, the mind, and the spirit. Not doing a quick examination and reaching for the prescription pad. Sitting with a human being and helping them to achieve their vital and hopefully celebratory life on the journey. Healthy environment, as I indicated. We stand for a U.S. healthcare system based on prevention, wellness, and well-being. We stand for a healthcare system based on health creation. Those are the words of Don Berwick. The Partner for Health organizations, we have grown exponentially in the past several years. We are now approximately 26 organizations strong, with others wishing to join. We represent approximately 600,000 providers, both conventional and, I'll use the term integrative or holistic. And we're about integrative. We're not about complementary alternative. We're about integrative. We're talking about the conventional system working alongside with a discipline of thousands of, let's call them, many of them, healers, people who really care. They spread their love, and they work through their discipline for every patient that comes across to them. At IHPC, we've developed a health creation economics pamphlet, which is on our website. Please feel free to download it. It actually compares the costs and shows that it's cost effective to have integrative health. As far as our federal and national initiatives, you know about this one. We also have a National Policy Advisory Council that we're forming, and I'm thrilled to announce that former Senator Tom Harkin has agreed to be the honorary chair. We have a National Policy Congress on integrative pain care. That was initiated by the Academy of Integrative Pain Care. Bob Twillman's the executive director. Bob, could you stand up for a moment, please? This was a historic meeting in San Diego where there were 50 organizations represented and approximately 70 individuals attending. We had representation, as far as the government, we had representation from CMS, DOD, the Veterans Administration, and we had integrative health associations, the American Academy of Family Practice. This was a historic meeting. Everyone was in consensus, and this is about looking for other solutions, not what you're hearing about now, but other solutions which you will hear in the future in regard to this caucus, about solutions to what I call the chronic physical and emotional pain crisis that we're facing. We're facing a crisis of suffering. To talk about the opioid crisis is one slice of the pie, in my mind. We have plenty of other initiatives going as well. And as far as this Congress, there are ongoing task forces formed, and we expect many organizations to join in that effort. It's a pleasure and honor to have had Mike Kaufman and Jared Polis co-sponsor this, and hopefully we will have many members of Congress join to have a rapid access to information, because believe me, we have a lot of information for you.